Hello and a very warm welcome to all of you. Today we have with us Dr. Saurabh Joshi. Dr. Joshi is a gold medalist, Vascular Interventional Radiologist from the Vein Center. The Vein Center is a world-class varicose veins treatment center. And Dr. Joshi, to his credits, has multiple international papers and presentations. And today he will tell us about the most advanced treatments of varicose veins. A very warm welcome to you, Dr. Saurabh Joshi.
Thank you. Thank you.
Doctor, please tell us about varicose veins. What are these?
Varicose veins are blue bulging veins seen on the legs which cause calf cramps, skin darkening and also open wounds called varicose ulcers.
Okay, and how common is this and what kind of people tend to get these?
Varicose veins is surprisingly common and they are seen in about 40% of the population above the age of 35, and these are seen in people who have to stand a lot, like teachers, professors, people working in marketing, in hospitality industry. And also one fact is it's seen in women over the age of 35 who have had more than 2 children. Now these women are very likely to get varicose veins.
And doctor, why do veins become varicose? What causes them to bulge out?
Yeah, see, basically I would start off with the basics. There are 2 types of blood vessels in the body, the arteries and the veins. Arteries take blood from the heart towards the other organs like the legs, and veins bring this blood back to the heart. Now in the veins there are some specialized organs called valves, which whenever we breathe, whenever we exercise and whenever we move our legs, these valves, they open and close, so this pumps the blood from the legs towards the heart. Okay. Now because of gravity, whenever we stand up, these valves, they push against gravity and send the blood back towards the heart. In certain people, say in 30% of the population, these valves are inherently weak, and especially in those who have to stand a lot, again there is a lot of pressure on the valves. So what happens is, as these valves become weaker, the column of blood remains standing in the veins, and that's why, because of the increased pressure, the veins become bulged out and swollen. Now at a point of time, the wall of the vein becomes so thin that blood products can actually ooze out of the vein and get deposited under the skin. This causes swelling of the skin, and as these products degrade, it causes darkening of the skin as well. So as the swelling progressively goes on increasing, at a point of time the skin can break open, and that will form a varicose ulcer, and that is exceedingly painful. So that's
okay. And how is varicose veins diagnosed?
Yeah. See, when a patient comes to us, we actually examine the patient, and that gives us an idea whether this patient has varicose veins or not. Bulging blue veins on the legs are very difficult to miss, so we just straight away see and find out that this patient is likely to have varicose veins. And then what we do, and what is different in our center from others, is we get the ultrasound color Doppler done at the same place. The doctor who's examining you is the same doctor who's doing the ultrasound. So when we do the ultrasound examination, we actually map out the veins, we see how the valves are working properly or not. We also take a look whether the blood is flowing in the right direction or not. So that, in short, is a planning for the treatment. If we have to do a laser treatment, then we have to have a proper roadmap in place. So and while we are examining and doing the ultrasound, we are actually planning for the later procedure at the same time. Yeah.
And doctor, how are varicose veins treated?
Yeah. See, varicose veins treatment, now traditionally varicose veins were treated by open surgery. That is, there had to be a big procedure where the varicose veins would actually be cut out from the leg, and then the patient would get stitches. Now this is called varicose vein stripping, and if you would get about 30-40 stitches on your leg, it will be exceedingly painful and you can't really go back to work the same day. Okay. So now the current gold standard for treatment for varicose veins is called endovenous laser ablation for varicose veins. Now how we do that is, once we have mapped out the veins from ultrasound, like we've already examined the patient, we've mapped out the veins, and now we've identified the main causative vein that causes varicose veins. So we take the patient to the OT and we put a small IV line needle, the small needle which we put the glucose saline with, that is put in the vein at the ankle. And now through that vein, a laser fiber device is navigated from the ankle, from inside the vein right up to the hip. Now this is all done without any cutting, without any stitches. We are looking with ultrasound and we are putting our device through. Now when this device reaches the beginning of the vein, where it starts from. After that, we give some local anesthesia along the length of the vein. Now, this is given so that the patient is comfortable and it doesn't hurt when we treat you. In certain patients who are very apprehensive and who just don't want any pain at all, we also have a full-time anesthetist with us. So we'll be giving a full general anesthesia. That is, patient sleeps throughout the procedure, and then we turn on the laser. Now, when we turn on the laser is applied. Laser energy is applied from the inside out. That means the vein is sealed from the inside, and the laser fiber is slowly taken out. So we treat the vein actually from the whole inside. That's how we do the laser varicose veins ablation.
The procedure looks great, doctor. But would you please tell us some patient stories?
Yeah, definitely. See, I had a patient who was working on a cruise ship somewhere around Spain. So what happened is he used to work for 12 hours a day, 15 hours a day, working around in the cruise ship, and he used to be working for 7 months straight, and 15 hours a day standing for 7 months. And this guy is a 22-year-old kid, and he came back home with swollen legs and huge calf cramps, don't know what to do. And we saw him, we did a color Doppler ultrasound, we found that this was from varicose veins. We treated him the very next day, and he was virtually pain-free from the next week onwards. So this is what, it's a revolutionary procedure and absolutely changes lives. And one more experience I want to share with you is a 75-year-old lady who is a professor in Marathi. That's like a PhD in Marathi. It's a very highly educated lady, and she had a 15-centimeter ulcer on the leg. That is from below the knee to the ankle. There is no skin. That's just a huge wound, and she was advised to get her leg cut off. She was advised amputation, that we can't save your leg. But we found out that this is actually a varicose ulcer, and what we did is we did the laser varicose veins treatment for her. After that, she had to undergo a plastic surgery to put healthy skin on that open area. And after doing that, 3 months later, we found that the skin graft had taken up properly, and she just got a new leg. So that's what, it's a revolutionary procedure that changes lives actually.
So doctor, do varicose veins come back after this laser treatment?
See, after the laser treatment, patient needs to take certain precautions, like wearing the compression stockings as advised. We advise wearing compression stockings for 12 hours a day for 6 months. In addition to that, the patient needs to avoid lifting heavy weights, avoiding weight training for at least 1 month after the procedure, and also avoiding to sit cross-legged. Now, if you take these proper precautions, then varicose veins do not usually come back.
Yes. And what happens if I leave my varicose veins untreated?
See, varicose veins are actually large stagnated pools of blood. That means blood is not actually flowing in the same way that it should flow.
Okay.
And what happens to blood which is stagnated, like if you put a drop of blood on the table, it will clot really quickly.
Yes.
So what happens is, because this blood is not flowing, it is more likely to clot. And in such patients with varicose veins which are not treated, this blood, if it clots in the veins, then it will cause another disease. It's called DVT, deep vein thrombosis. Now, deep vein thrombosis, this clot can break off from the deep veins and then go into the lungs and cause pulmonary embolism. That is a real serious condition. In addition to this complication, patients who are not treated for varicose veins at an early stage will invariably come back later with swelling of the legs, skin darkening, and open wounds. So it needs to be, the earlier that it is treated, the faster is the recovery.
Okay. And what is the cost of this treatment?
Yeah. See, cost of the treatment. Now, if you compare the cost of treatment for laser procedure with the open surgical procedure, now this open surgical procedure obviously costs less because there's not much technology involved. Okay.
Yes.
So it would cost about half of the open surgical the laser procedure. Like, for example, approximate cost for a laser procedure would be about 1 lakh rupees. That is about 2,000 US dollars. And the cost of the open surgery would be around 50 to 60,000 rupees. But after the open surgical procedure, the patient is bedridden for 7 days and you're off work for 3 months. While after the laser procedure, you're on your feet virtually hours after the procedure, and you can go back to work the very next day. So although the cost of the procedure might seem high, the quality of life is much better after treatment by laser.
Of course it is. And doctor, is this treatment covered by insurance?
Yes, varicose veins is covered by insurance. Typically, a personal insurance policy requires the policy to be running for 3 years for the varicose veins to be covered, and corporate insurance policies covers varicose veins straight away. Now, this is particularly for the Indian population. We also take foreign insurance coverages which cover this disease straight away. As soon as you take the policy, the insurance covers the disease.
Okay. And are there any side effects that can occur after this treatment?
Yes, there are certain side effects that can occur after the treatment. These side effects are certain pain and discomfort along the treated vein, redness along the treated vein. These are short-term side effects which last about 8 to 10 days. We give the patient certain medications to minimize the discomfort. Along with this, certain patients can get some tingling or numbness along the ankles. Now, this occurs because the heat energy which is delivered to the vein also reaches a nerve that carries sensation around the ankle. This numbness eventually goes away within a month or two. In addition to this, very few number of patients can get deep vein thrombosis, that is clotting in the veins, because of this treatment. But in our practice, we give the patients certain anticoagulants or blood thinners during the procedure and a few days after the procedure to minimize the risk of TVT.
Okay. And what are the precautions that need to be taken?
Yeah. Immediately after the procedure, the patient needs to wear the compression stockings for 48 hours continuously. After that, these stockings need to be worn for 12 hours a day whenever it is the most active period of the day. That is, if you're working in the night shift, the stockings must be on your leg in the night and it should be off when you're sleeping. This should be continued for 6 months of time. In addition to this, there are certain restrictions on lifting heavy weights, and fully flexing your knees, that is sitting cross-legged, should be avoided for at least a month.
Thank you so much, doctor, for enlightening us with so much of information, and we can now get ourselves rid of this painful varicose veins with this.
Thank you.
Thank you so much.